Curas is our business partner. We link arms on everything we do with our EMR.
Curas started working with St. Anthony's Physicians Organization in July 2006. We started working with Fenton Family Medicine with Dr. Hugos and Dr. Broyles. They were the first office in St. Anthony's to start using eClinicalWorks. Since then, they've rolled out electronic medical records to over 65 providers in the South County area, and they were the first hospital system in the area to fully adopt electronic records in their physician offices.
We were a much smaller physician organization at that point in time, and we said, what kind of resources do we need to make this implementation successful? And working with a consulting company like Curas, who knew the software, had the trainers, knew the ins and outs of ECW, seemed like a very reasonable idea, and we pursued that, and very glad that we did.
Throughout the country, eClinicalWorks is leading the way with meaningful use attestation. The last numbers I saw had eClinicalWorks clearly in the lead in terms of number of providers over the other vendors in the country. Specifically in the case of SAPO, being a larger organization, they've got a lot more doctors, a lot more staff to kind of navigate through this. And eClinicalWorks really makes it easy with their MAC dashboard, which lets a physician see measure by measure how they're doing with respect to meaningful use. Also, because it's easier to use, it makes it easier for physicians and staff to adopt these new features so that they can achieve meaningful use more easily.
One of the excellent tools that ECW provides to their customers through 9.0 is the use of meaningful use dashboards that can be viewed individually by provider or can be rolled up to a clinic view or an organizational view. We use those tools to monitor our progress across all 25 objectives to get us to the point where we can do attestation per eligible professional.
Curas was very helpful in answering questions or acting as a liaison to ECW for us, and we're a little unsure about this measure. What does it mean, or how does ECW recommend that we attest? And Curas was very helpful with that communication and that piece of that puzzle.
There are 39 physicians at SAPO who have attested for meaningful use. Of those 39, 23 have received payment for the first year of stage 1 of meaningful use.
Curas was able to bring its experience from helping other organizations achieve meaningful use to bear with SAPO's efforts in attesting for meaningful use. Our trainers, our staff are already experienced with meaningful use criteria, and we had experience with how to train and roll out meaningful use features. So we were able to bring all of that to bear and help St. Anthony's achieve their meaningful use more easily.
Curas is our business partner. We link arms on everything we do with our EMR. We rely on them for their expertise and guidance as we move forward on our versions of ECW, our feature sets, and we view them as an equal partner in delivering the EMR to our physicians and ultimately our patients. So they are extremely helpful in delivering quality care to our patients.